When I used to be the hospital administrator, we would do case studies as to and research what it takes to do a job, the education involved, how much workload is involved with every job, and you add all those jobs up for parents that have disabled kids, and you find out that you're doing the job of probably 5 people that I had employed in the hospital when I used to be a hospital administrator of a small rural hospital. And that is what is being expected for these parents. And if the medical community truly wanted these kids to recover, they would not be putting all of these roadblocks and barriers for us to recover. And there's something really wrong going on at the very top level of our healthcare systems. Okay, hi, I'm Beth, and I'm a mom of 3 sons. All have had vaccine injuries. I want to just prelude before the vaccines to when I was growing up in the middle of rural farm country in North Dakota. We had heard in the 1950s of this neighbor. Their child went in and had vaccines. That baby cried in the office. It cried all night long, and that baby died the very next day. This was like about 1956 or so, and so we had heard this story, and many people did not really put 2 and 2 together. However, that mom, that grandma absolutely knew that it was the vaccinations. So I had heard that there could possibly be a correlation, and that was before I was born. So I had my kids. I was seeking wellness care, chiropractic care prenatally and before I was pregnant. And the chiropractor mentioned about not having vaccines, but there still was not the education of that, and this was about 20 years ago. And there was no internet at that time, and so I wasn't sure what I wanted to do. My sister, who has a very large family, she also warned me about vaccines. Not that she had kids that had injuries. She chose to have none of her kids vaccines. So I started to hear some information, but I didn't research it enough, was not educated about it, and pre-internet and not knowing where to get information to learn about it, I didn't know what to do. Of course, the medical community was certain that vaccines were safe, and I had been vaccinated. My mom never missed a schedule at all when I grew up, or a booster, so I'm heavily vaccinated. So sick moms have sick kids, and I was sick with ear infections and a bunch of illnesses when I was younger. So when I was pregnant with my first son, he was vaccinated because I didn't have the information I needed to do, but I questioned it and I didn't know how to get information. At 13 months, he had his MMR vaccination. This was in the middle of July in Minnesota, and so he had a fever of 104.2, and this fever lasted about 3 days. I had called the nurse helpline, and they said, of course it's not vaccine related. He did not have any cold symptoms other than this high fever. And so then I had decided from that time on I was not going to vaccinate, but I didn't know how to put that in place for my second-born child. Right after this firstborn child was born, I also had a repair after the pregnancy and delivery, and I could not detox the anesthesia from that repair after that firstborn child, so I had these toxins in my body from anesthesia. Then I was pregnant with my second-born child, and he was delivered 2 weeks early, which is not too early, but we went into the hospital. He was delivered. They told us he had an APGAR score of 9, very healthy boy. And 20 minutes later, when I came to my senses, and I said, no shots. And the nurse turned to me and she says, too late. And I'm just going, how can that be too late? Don't they have you sign off on something? Don't they ask you permission? Don't they wait longer than that? He had the Hep B shot and he had a vitamin K shot. Not too long afterward that evening, my son started to have rapid heartbeat, rapid breathing, rapid pulse. We called the nurses in. The doctor then ordered the x-ray. They whisked him down for an x-ray, and they came back and said he has transient tachypnea. All that means is he has rapid heartbeat, rapid breathing, rapid pulse. It has nothing to do with any causal factors. The next day we chose circumcision for him, and he completely shut down so much that he would not open his eyes for a newborn photo, and he was just this tight little baby. He did not progress the first month, or the first week actually. He had lost weight, and so then we had nurses' visits because he did not thrive for a while. He was totally breastfed and all of that for a while until he stopped breastfeeding. He did not sleep well, hardly at all, did not nap well as a child. This child right now, our second born, is 17 and a half years old, and he has autism, he has mental illness. He has oppositional defiance disorder, which makes it very difficult for him to go in to have treatments and therapies done because he refuses to go a lot of high refusal. He has generalized anxiety disorder that is very severe and significant. He has insomnia. He has ADHD. He has sensory issues. He has dysthymia, low-grade depression. He is supposed to be a senior this year, and he is not going to get his high school diploma. His IQ is average to above average, so he's smart, he's high functioning, and we're very blessed that he's high functioning. However, his neuropsych evals show and have repeatedly shown that on a adaptive functional level, he is at a retardation level. So this child is going to be cared for by us and cannot make good sense of things, even though he thinks he knows everything, and we're glad that he's high functioning. It's just that he doesn't have the life skills to be able to really do well in life and do optimal. So we have struggled for years trying to get the right treatment and care for him, and it's been a battle with insurance companies. We purchased Tefra that's $1,200 a month every month just for the one child. That's on top of our regular medical insurance just for the one child. And then we have a lot of out-of-pocket costs going for therapies that are more powerful, more effective than what the conventional medicine has ever provided for us. And I've had a difficulty navigating the mental health system, the autism system, even though I was a hospital administrator in a rural hospital in Minnesota before I had my kids. And the system does not make it easy for anyone to be able to access care, let alone have the money that is available, and you have to scrape the money and prove your case. My son did not get to be declared disabled till he was 14 years old. We didn't get any early intervention because of that. He never got ABA therapy. We have tried to get in-home therapy, and it's just training parental strategies. And he just now he had a caddy waiver for 3 years, and then we got a waiver. So for the first time he had a waiver, he was 17 years old. He's 17 and a half. We've had a waiver only for the last 8 months. Now I've had to battle to get alternative therapies covered by the waiver, and if it wasn't for the grace of God of some fabulous medical doctor that my son has, and I've got 2 of them for my son that will understand. They have researched, they know this community, they understand what's going on with kids that have these diagnoses, they understand the chronic illnesses attached to them. If it wasn't for those docs that signed those alternative treatment forms, my son would not be getting neurotherapy, neurofeedback therapy, biotherapy. He's now getting that, just started just the last couple weeks. He's gone in for 3 sessions. We've waited this long. We've been trying to do biomedical work with him and high supplementation, and that was all out of pocket for years and years and years, and it's nearly bankrupt our family. We've double mortgaged our house, just like all the families we've taken out of our retirement. And for a husband that is an engineer and myself that used to be a hospital administrator, I have not been able to work for the last 17 years. I take care of my son, and I have to navigate the process of all of this and juggle all these things, and it's just, we go to bed every night just exhausted, and it's too much workload. So this is our story, and it's ongoing. It's daily, it's hourly with us, with behaviors, violent behaviors, involved with the criminal justice system at one point. the problems never cease with this child. And we have another 15-year-old now, another son that was injured the day he was born, and he has ADHD, behavior disorder, and he also has behavior disorder and one more disorder I can't remember. But he is high enough functioning where he can get decent grades. But oftentimes these kids that are their global effective functioning score on their neuro psychological assessments, if they miss it like he does by 10 points, he does not qualify for services, so anything we do with him would be out of pocket if we even had the time to treat our other son, and we can't. Oftentimes these kids that are doing fairly well now and holding it together as best they can, he comes home and he crashes at night, or he explodes when he comes home at night. Sure, he functions okay at school and it looks like he's doing well. Oftentimes these are the kids that are self-harming or committing suicide in college, or when they get out in the workplace, things fall apart for them because they didn't get the services they needed. So this is the story of many families. There are many families that have worse situation. I feel blessed, but it is by no means a walk in the park. These kids need treatment, and we need to take it seriously what the vaccines and what they've done and how they've injured these kids. So.
Thank you.
Thank you.
Thank you so much for
Thanks.
telling your story so well. Such an education. We so appreciate it.
Thank
Have
you.
you put their names on the bus?
I put my one son's name on the bus, not the other two.
All right. Thank you. Okay,
Thank you.
Periscope, we have
Thank you
got
for the
more stories.
opportunity for doing that. Thank you so much for what you're doing.